Welcome back, Caylee Clay, to the Dish with Dina podcast. You are the first ever returning guest on here, and I'm so excited. It's like a Where Are They Now episode. How are you?
I'm doing well. I'm so excited to be back. I'm happy to be talking again.
This is so fantastic. Obviously, we'll get to know a little bit more about you in the conversation we're having. But the thing I kept reflecting on, and I mentioned this earlier before we officially hit record, you were on season 2 of this podcast, episode 19. This was back in early November of 2020. And even though we were kind of in different chapters of our lives, I felt like I'm so proud of how far you've come. You've really gone through so many things, but you've also really kept very true to a particular message and mission. And I can't wait to hear more about how that came about because, a lot of people don't stick to things or we get a little distracted. And I'm just so thrilled to have you on here. Give us kind of like the rundown, who you are, what you do, where you're at right now, a little snippet of that, and then we'll get a little bit more into detail.
Yeah. So my name is Caylee Clay. I am a dietitian. I specialize in treating autoimmune disease using nutrition, and I particularly do this by using an anti-diet focus or perspective. So yeah, I'm glad to hear that. I've stayed true to my path recently. It took a while to get here, so I'm happy to have arrived.
That's something I really want to learn a little bit more about because, like some of us in this profession, not everybody has to have some personal insight into what our specialty or interest is. But in your particular case, that is what you were looking for. You were looking to see how people can get treated, and you knew the complexities and challenges of people who are living with conditions related to autoimmune disease. So tell us a little bit about the origin story from there. Go back a little bit from when you first became a dietitian and you were kind of collecting this information and where this is leading you now in a broader scope.
Yeah. So I think it kind of really started when I was about 16. I had strep and the flu at the same time. And strep is famous for causing the like a new onset psoriasis. And that's what happened to me. It was very mild for many years until ironically I was studying nutrition at the college level. After I graduated and became a dietitian, I knew that I wanted to be doing something with my psoriasis, but kind of the first rabbit hole I went down was Candida albicans overgrowth. And so that was kind of the first thing that I thought I wanted to specialize in. And I realized there was more to the story for psoriasis than that. And then the more I got working into psoriasis, the more I realized that the community really views autoimmune disease appropriately under an umbrella. And I really wanted to be addressing autoimmune diseases at large and kind of stepping back and having a little bit bigger view than just psoriasis alone has really helped me to understand even psoriasis better and looking at different autoimmune diseases, their nutrition implications. It's really made for a nice big picture view of what's going on.
Walk us through a little bit too about the studies it's themselves, because as I've mentioned in some of these previous episodes, both with dietetic colleagues and also we've had some students on here too, sometimes the textbook is only covering so many chapters of certain things and doesn't really dive very deep. So there might be GI related issues that feel like they might sort of be related to autoimmune or skin conditions, but we're not really able to apply a specific medical nutrition therapy approach, which is MNT, what dietitians do. So, where was it that you started learning about like this might not really cover what I need to know, and I think I might need to go a little bit deeper? Can you share a little bit about some of that part of your story?
I think, kind of like you're suggesting, as far as my memory goes, I don't remember learning anything in school about autoimmune disease and nutrition at all. To be fair, I graduated a few years ago, and I think a lot of this stuff is really starting to come out of the woodwork now. And you're right too, it can get really complicated. For example, there are autoimmune diseases that exist in the GI tract. Specifically, we see different organs affected with different diseases. But then conversely too, the research is pretty clear that there are autoimmune diseases that don't obviously have anything to do with the GI system, but we do see gastrointestinal symptoms crop up in these other diseases. And then also there can be other conditions that exist that can kind of like complicate or maybe even confuse autoimmune symptoms or even disease progression. So yeah, there's a lot of like cross wires, and it's a lot to untangle.
This is the thing that I'm writing down with, the language that comes to my head when I think of things like this is it corresponds to some of the education we had around allergies or flare-ups and how to control like systems, or I should say symptoms of whatever was triggering us. But again, every individual might be dealing with something completely different. So do you see some correlation as far as like organ systems? Like, is there always an accountability part towards like the endocrinology discussion or the gastroenterology discussion? Is there something that feels like there's a thread running through all of this that might mitigate or might be addressed first when people come to you for help in managing their condition?
The one thing that I see pretty consistently, and the research too, is like, in my opinion, very clear that people living with autoimmune diseases often are also living with micronutrient deficiencies. That's always where I'm starting with my patients. I mean, maybe I'm also starting at the foundations of nutrition if that's what's indicated for that person. Vitamin D is a huge one, zinc, selenium, magnesium, some heavy hitters that we just see commonly.
But at the time of this recording, I'm quite literally presenting on toxicities and deficiencies on Thursday, and the micronutrient conversation comes up. And so here's where I think sometimes the question or curiosity is with both the practitioner and also the patient or the client of how much of too much is anything? What is it that I'm approaching first? If I feel sometimes that foods are unsafe, then how am I supposed to have like a whole food diet? And then where do I go with a supplementation and how far does that even get me? Because the whole point of supplementation is to be in addition to things that you're not necessarily getting in the right amount in your natural, diverse, balanced, varied diet. So, what are some of the approaches that you're taking, or what are some of the assessments that you're doing and going through with your own patient population?
I mean, right off the bat, I like to check out vitamin D levels. Often it's something that we see in people's blood work, or maybe they have a memory of even an old vitamin D reading. That's kind of one of the first places that I like to start. If people are dealing with fatigue specifically, I love to recommend a multivitamin that has a really high success rate in my experience of alleviating fatigue. The other consideration, though, however, is if we know or we suspect that someone is living with especially small intestinal bacterial overgrowth, SIBO, then people might very well be eating, a well balanced diet, but we know that they're not actually getting those nutrients absorbed. So, kind of figuring out, doing the easy things, vitamin D, multivitamin, and then also at least looking, I would say, at a not too high level, like a medium level, to see if there might be absorption issues too.
While I believe an autoimmune condition there is a diagnosis there, it's not a ruling out of something. It's clearly like this is what the condition is. Is that correct? Like how they get diagnosed with it?
That is, I think, one of the most frustrating things that people living with autoimmune disease or suspected autoimmune disease oftentimes have to endure, which is the diagnosis process. Unfortunately, there is no like set of a single test or set of tests that we can use to diagnose autoimmune disease. Some people go a long time without getting diagnosed. Some people are never diagnosed. I see this a lot with connective tissue disorders, where a rheumatologist might be like, seems autoimmune, you're in a lot of pain, so it's probably a connective tissue issue. And maybe there's some elevated autoantibodies as well. But perhaps that doctor doesn't feel comfortable actually fully diagnosing them. So yeah, sometimes we're in this sort of like nebulous gray area. And what happens, I like to tell my patients if they're in that area, is like, best case scenario is that we get things situated so that they feel better and never get diagnosed. So I think that's a relief for some people to hear.
Right, right. Like the label aside, because I think what comes up for me a lot of times with these conditions is it does feel quite frustrating. And sometimes in the opposite way, instead of kind of everything being thrown at them, like maybe it's this, maybe it's that, it feels like sometimes they are being dismissed and not heard, that it's all in their head, or they're being too sensitive towards something, or it might be correlated to disordered eating patterns. And that's why they don't feel comfortable or safe ingesting certain types of foods when really it's clearly a trigger or a flare up that they're trying to avoid. And so that brings
Mhm.
in, right, the whole like sociological and behavioral aspect of a lot of what we do, Caylee, in our profession, where we might not be super savvy to pick up on those things. So talk to me a little bit about that too, like putting someone at ease, like you said, obviously approaching things with a food first discussion or integrating some sort of modifications to their micronutrient intake. But what about just like alleviating their stress about having to manage something, socializing when they go out to eat? What are some of the things that you feel you do to support that?
I will say right off the bat, I just have kind of a standing policy that I just believe my patients. Like whatever they tell me, I believe them. So I think that does help. And it's unfortunately it's very easy to be empathetic with my patients because they're living with a lot, they're going through a lot, and a lot of them are living with these very severe symptoms. And like they might be holding up their entire family. I'm thinking of one patient in particular. I'm like, I know she's the backbone of her family. So there's just so much on her shoulders. So just sharing with my patients, like, I see what's on your proverbial plate, and it's a lot, is the first thing that I try to do.
Just the mere fact that they have you as a sounding board, I think really alleviates that as well, especially if they have been going through a variety of different doctors, specialists, or treatment plans. Like, let's talk a little bit too about self-treating. It's, we're in an age right now where there's so many things that you can access online. Don't even get me started on the chat GPT discussion and all of that. Where are we feeling comfortable with allowing people to experiment on themselves, and where do we feel like we have to kind of encourage them, like, please be careful and conscientious as to who you're following and what you're following, that you may be doing more harm than good, especially when we're talking about autoimmune disorders.
Yeah, you're right. It's such a thin line. And for me, that really kind of goes back to the concept of dieting. In the autoimmune world, we see lots of people encouraging various types of diets, some of which are very strict and very intense, to be honest. And man, I've had patients come to me just like crying because they're like, I was on this really strict diet and I felt good, but I can't do it. Like, now what? And there's this false dichotomy presented where it's like you're on the strict diet and you feel better, or you're not on it and you feel like trash. And so, sometimes I'll say to my patients, like, I'm here to offer you a third option. It doesn't have to be extreme. You don't have to give up. There is a place in the middle. And if we look at the research that has been done on especially stricter diets and autoimmune disease, the evidence is just not there. And there's much stronger evidence for correcting micronutrient deficiencies than there are for strict diets. And also, we know that people who live with autoimmune disease have higher rates of eating disorders, and there's evidence also showing vice versa to be true as well. And so, recommending strict diets to folks who might be at risk of eating disorder is just, it's not appropriate, it's not ethical, it's not evidence-based or science-based. But yeah, we do have to sometimes enter this realm of like self-experimentation. One way that I like to approach that is, some of the autoimmune diets will say, okay, stop eating all of these foods and we're going to slowly introduce them one by one. That is just not real life. People don't live like that. That's extremely exhausting and time consuming. So instead, what I'll tell my patients is, let's identify one food that we think may be an issue. The first step is to find appropriate substitutes. So, like, for example, gluten. We need to find, if you love to have a sandwich every day, we need to find a gluten-free bread that you like, that like works for you. So the first thing is finding, having a game plan, having appropriate substitutes. Then I'll have them trial for 1 month without it. And, mistakes are going to be made. It's not going to be perfect, and that's perfectly fine. But by the end of that month, like, people know. They're either like, I feel way better, or like, didn't really do much. And we can move on to something else.
I want to ask you a little bit about that too, with these approaches and removing, and we've had conversations like this in the past episodes. If you're removing complete food groups, you definitely have to still substitute the quantity of your food. You have to be running on an energetic level to get through the course of the day and let your cells function. And so when we look at those top 9 allergens, I think the two that tend to get pulled out a lot are dairy and gluten, right? They tend to
Yeah.
be what people think of as the most inflammatory. Is that true? Like, do you see a lot of commonality through that? And is that usually the first thing that you might want to experiment with? Because again, we try to be careful with, all foods fit and everything's fine and there's not any quote unquote bad foods, but it could be things that tend to trigger people more often, even if, like you said, sometimes the science might not be heavily weighted in one direction or the other. But as practice-based evidence, how, what are you coming across most often if that feels like that's the
Yeah.
case?
Well, I will say specifically for Hashimoto's, which is autoimmune hypothyroidism, there is like a decent body of evidence indicating that gluten-free may be beneficial for these patients. I've actually been poring over the research for psoriasis. I'm presenting to the National Psoriasis Foundation in a few weeks now. So, in digging through all the psoriasis research. So that is kind of interesting. The evidence at this point in time for psoriasis is that there isn't really enough evidence to recommend a gluten-free diet for everyone, but the researchers do suggest basically a case by case basis. So it seems like even the researchers are starting to see that with certain autoimmune diseases like psoriasis, that some folks may be sensitive. Um, and so, but you're absolutely right. Gluten and dairy, unfortunately, are some of the top offenders that I do see annoyingly. I think nightshade vegetables tend to top the list too. But one thing I do want to mention is generally what I prefer to do is before going down the path of food sensitivities is really taking a step back and trying to figure out if there's something that may be causing food sensitivities first. So we already mentioned small intestinal bacterial overgrowth. That can cause a whole litany of food sensitivities. There's also some evidence that, especially people living with hypothyroidism, may be sensitive to foods that are higher in histamine. So sometimes we see histamine intolerance, and working with higher histamine foods can be beneficial. Sometimes people are living with MCAS, mast cell activation syndrome, or oral allergy syndrome. So first taking a step back and saying, like, is there like a pattern that we can pull out before we just randomly start, eliminating foods is really where I think is more of a science-based approach.
I very much appreciate that. And thank you for clarifying as well, because I didn't realize that there was either research emerging or just research that is existing that we just weren't privy to if we're not focused on a particular specialty or patient population or condition in that sense. So I appreciate that because, yeah, like RIP dairy, everybody, right, who likes cheese and things like that. But sometimes it's just going to be the name of the game. Like you definitely don't want flare-ups because that puts the body in an inflammatory response, and then that leads to other unfortunate things down the line. And also, we're not demonizing the foods in general. We're not saying all foods are bad. It's just that people with, like you said, on a case by case basis might benefit from some trial and error or from some elimination and making sure that we can replace it in some way so that they are getting the micronutrients and they're also getting the calories that they need as well. One of the things I had written down too was the histamine. Can you talk a little bit more about that for anybody who might not be familiar with the language that you're using? What exactly is that response? What are those types of foods that are entailing in that world?
Yeah, yeah. So something I hear a lot from my patients is they'll say like, I eat and then I have to like clear my throat, like I have like postnasal drip. Or I have another patient who she's like, I can't eat without having to blow my nose in between. Or sometimes we do see more serious symptoms like hives or rashes, or there's even some symptoms that can be just totally unexpected, like low blood pressure. And so, if you know what you're looking for, it's possible to say, like, oh, maybe you're dealing with a histamine issue. So I like to explain it in terms of allergies. A lot of people are familiar with taking antihistamines to treat allergies. So there are foods that some of them are higher in histamines, some of them release histamines, some of them have compounds that are similar to histamines. And so for those who are sensitive, eating those foods might trigger these sort of like, allergy like responses. Um, and so that's really what that is.
It goes back to that, what you were saying before, that underlying root cause of what the condition is that is causing that sensitivity and the threshold, right? How much is too much for anyone can really depend on what your body is able to tolerate. And that
Yeah.
goes exactly kind of like almost the definition of what you're talking about there, Caylee. All right, let's get into a current week in the life of you. So flash forward 5 years now from where we first had our
Yeah.
conversation, where we were just diving into some of this discussion. Tell us a little bit about what you're doing these days, like literally, and maybe, figuratively, we'll talk about later on too of the marketing and things like that. But tell us a little bit about what you're working on, what a current week in the life of you is, and how you're juggling all the things.
Yeah. So at this point in time, I see patients 3 days a week. And then the other 2 days of the week, I am really trying to focus on presentations, classes, speaking events. Excuse me, last time we spoke, I was doing a lot of writing. I always want to be doing more writing, but between those two things, I don't quite get to do nearly as much writing as I would like to. But that's kind of the place I'm in now, is working with patients. And then most of my classes and presentations are really geared towards healthcare providers.
So we're talking about training the colleagues as well and understanding and having the ability to either have them refer patients to you or work in collaboration with each other so that you can be part of their interdisciplinary team. Okay, so this is the PSA part of the program, everybody. I think everybody, right, you might agree with this. I think everybody would benefit from meeting with a dietitian at least once, regardless of what the issue is. And I
Yeah.
will acknowledge insurance may or may not cover preventative care, and your doctor may or may not realize that we exist in a way that they can utilize us. So just to kind of get some understanding, like some guidance and baseline stuff, I think Caylee, what you're talking about too is, especially if you're on this journey of self-discovery and self-exploration and self-experimentation, is just to run it past somebody who might understand a little bit better than different parts of your healthcare providers, because they've all been trained in different things, but not nutrition, or not in the sense or the way that we have been. So we sometimes have that keen, new, fresh set of eyes that can lay upon whatever you're bringing to us and kind of analyze that for you. And like you were saying, Caylee, go through and kind of say, did you ever think of this question first before you even ventured into that question? So I really appreciate that. In addition to what you're currently doing, let's talk too about marketing and getting your name out there. Are you on social media 24/7 like I used to be and I am no longer? Are you boots on the grounds, like, not just the conferences and the speaking engagements? Are you also doing things kind of what I call like in concentric circles within your neighborhood, your borough, your city, your state? Tell us a little bit about your outreach and that kind of plan you have to get your message out.
I too had to take a big step away from social media. The returns were just not there simply in terms of time. And I think that landscape is really changing to really like a pay to play type scenario. So yeah, still active, but less so. As you know, I've been enjoying Blue Sky a little bit more. So that's been enjoyable. And then yeah, I feel terribly fortunate because it was almost like a speak it into existence type situation where yeah, like I think it was really towards the beginning of the year. I was like, I want to talk. I want to do talks. And I'm a total weirdo. I love presenting. I love public speaking. And so I was like, that's something I want to do. And this connection between autoimmune diseases and eating disorders is and it's plain to see if you look at the research, but no one knows that this connection exists, and the research is building, demonstrating this connection. So I was like, I want to be telling my healthcare providers about, my fellow healthcare providers about this. And I was approached to give a presentation to the New Jersey Academy of Nutrition and Dietetics. That was a wonderful experience. And then soon after that, I presented to the Oregon Washington Academy of Nutrition and Dietetics. And then, as I mentioned earlier, I was reached out to by the National Psoriasis Foundation to this time give a presentation to medical doctors. So it's been a great experience, and it seems like the universe is, on
Yeah,
my side.
I love the
Yeah.
speaking into existence. We've talked a lot on this podcast too about, the manifestation of things, but just letting people know what you're doing and then being open to receiving that. So that sometimes means taking some things off your plate that are not necessarily aligned with where you want to go, whether or not you have to give up some financial compensation in order to make room for that. So I really love that approach too, that you are open to doing things that are furthering your journey as your profession, but also making sure that the word gets out there to reach more patients, clients, and then, like you said, colleagues, our healthcare providers. So I have a question about if you have come across anything that you feel might be a very hot topic, whether it's something you want to clarify, debunk, or just dive a little bit deeper into, like what seems to kind of be the theme that comes up a lot in some of the discussions that you hear either with your healthcare colleagues or when you're working with patients one-on-one.
Well, I will say working with patients one-on-one, and kind of, we did discuss this a little bit already, but kind of this belief that diets work is something that many of us dietitians are trying to dismantle. And I think it's such a funny psychology experiment almost, because people go on diets. I mean, I guess they work, like people will lose weight and, do see improvements, but we know they're short-lived. We know they don't last, and we know they're impossible to upkeep. And then when people can't upkeep these impossible rules, they blame themselves, which I think is really fascinating. So yeah, if you're listening to this and have experimented with diets, just know it's not you, it's the diet. So trying to debunk that, and then also just trying to really provide my patients with enough structure to, have a good nutrition foundation, but not an excessive amount of structure that, might really kind of lead into a diet, is sort of this balance that I'm trying to constantly strike.
It's one of those things where it's a flexible approach where, yes, you are planning and you're preparing, especially if you're managing a condition that can be quite sensitive to the food that you're eating, but it can also be sensitive to other habits too, right, Caylee, like sleep and stress affecting
Yeah.
your hormones and physical activity, mobility, motility. That's all tied into digestion and metabolism and brain health and gut health. And so, talk to us a little bit about that too. The other factors, being a human being, we often say it feels like a flipping full-time job, just kind of keeping us alive, and what
Mm-hmm.
we are individually responsible for versus what resources might be out there for us to seek out and get support from, whether or not we have to pay or they come along with our insurance or they're, free downloads of things. Where do you see some of that maybe integrating into your conversations too, of this, balance of life and prioritizing our health in a world that feels very fast paced and that we're not necessarily tied to some of that, those priorities or those commitments?
You're absolutely right. There are, nutrition can affect autoimmune outcomes, as I said, but you're absolutely right that there are other factors at play for sure. So, like you mentioned, stress is a huge, huge, well-known thing that can trigger a flare-up, and it can even trigger new onset autoimmune diseases. Sadly, ACE scores, so which is childhood trauma, is correlated with adult onset autoimmune disease. So even stressful events, traumatic events that happened in the past can still affect our health into the future. So stress is a huge one. Infections is a big one. I mentioned strep throat. Epstein-Barr virus is another common one that we see precipitating new onset autoimmune diseases. COVID infections precipitate new onset autoimmune diseases at times. And I notice for myself, at times when I'm very prone to respiratory illness, at times when I get respiratory illness, I'll get a flare up, and then other times I don't. So I guess it just depends on what infection I got specifically. And then some other things too that I think we don't talk about nearly enough in healthcare is air pollution. I have had, there was a few years ago, I was in complete remission from my autoimmune disease. I was in Colorado, where I'm from. It was summertime, and they were just having terrible, terrible wildfires. And so we couldn't really go outside. We had HEPA air filters running and all the windows closed and everything. But even still, my psoriasis flared up. And the opposite happened at the beginning of the COVID pandemic, when New York City shut down. And I now live in New York City, and it was wild. I don't know if you had this experience, Dina, but when all the traffic disappeared, like literally the air was like thinner. It felt different in my nose. It was wild, and my psoriasis got a lot better after that, all the traffic disappeared for a short while, and that's when I like filled every single room of my home with HEPA air filters. So hopefully that helps a little bit. And then yeah, just another thing you mentioned, sleep, huge. Yeah, those are kind of the big factors that are immediately coming to mind.
It's a hard thing to say to somebody, prioritize everything. But I think the real
Yeah.
conversation is about what is taking up your time and where can we make small but significant steps
Mm.
towards supporting your health. And I think, just as a side note, the discussion around air pollution is cracking me up because one of my examples that I tend to give to people who are always asking me very specific questions about what are your thoughts about this particular diet, or what do you think about organic food? I'm like, pick your battles because you're breathing in bus fumes. You live in New York City. Like, it doesn't matter. You're not in a hermetically sealed laboratory. You still step aside and are doing that. So I 100% agree with you that there was a shift. And even as I've said before, when I'm in New Jersey. I'm in Ocean County right now as we're in this recording. Even just being down here, we're closer to the beach. It's obviously further away from the city. Night and day, the way that my skin feels, the inside of my nose feels, my energy feels. And that's something that we're venturing outside. We can't help it, but I think, to acknowledge that that plays a role too. And how, quote unquote, strict are you going to be with your diet when there might be other things and other factors that you live next to a factory, or you live in smog that you might not be able to have control over. So yeah, so thank you for pointing that out, because that definitely, my antenna went up a little bit when you were mentioning that. Caylee, let's talk too about the future of you. This is 5 years in the past, 5 years since we saw you and we talked to you for the first time. So where might the next 5 years be taking you?
Great question, an exciting question for sure. I do say I the last time we met, I was kind of at the final stages of writing my book. So I'm hoping I have at least two more books in me. I think that I'm ready to update the book that I did write. So like I can find some time to do that. And then at some point too, I would love to write a comprehensive book on like basically all autoimmune diseases or more autoimmune diseases and nutrition. So hopefully that will someday become something that I can work on. And then I really hope to be doing more presentations and classes and speaking. That's something that I really enjoy. And also working with patients one-on-one is something that I don't think I'll ever quite want to give up or be able to give up. There's something just really unique and special about working one-on-one with people.
I've just been reflecting a lot about this too, is, the telehealth, the remote learning, the virtual stuff, the webinars. I don't know what people look like from the neck down anymore. Like, it bums me out. And so that's something that I'd really love to try to get back into. Just before our conversation, I had another guest on and we were talking about that boots on the ground approach, food demos, hands-on things. Yeah, okay, you can have a larger audience in a group setting, maybe too, if you just blast out and you're doing, live feeds of whatever your topic, your presentation, or your counseling session is. But then there's something also very sweet about having face-to-face interaction and being live and in person that I think I miss that. I miss that energy that you can kind of like look in people's eyes and they have their cameras on or not off, and they're actually like in person with me. So that's something too that I'm going to try to move forward to. And so I share all this because whoever's listening or watching this, think about what works for you. Caylee and I have had a wide variety of conversations just within this episode that maybe give you things to think about, whether you're coming from it from the standpoint of a healthcare provider looking to work more in collaboration with other people who are specializing and have more expertise into a particular topic, and there's no shame in the game. And then on the patient's end or the general population's end, what is it that you want to learn? Where are things that you feel like are not really working for you anymore? What boundaries can you set both with yourself and with others? Because as you were saying too, Caylee, with the stress, this comes up a ton. Like, sometimes we're just in relationships, whether they are personal or professional relationships, that don't serve us anymore. And then it's affecting how we eat or the behaviors of our own person, not taking care of ourselves. And so, we get it. We're human. It's a lot to juggle all this stuff. Like I said, it's a flipping full-time job just to stay alive, I think. Caylee, is there anything else that as we're coming upon the end of our conversation, we didn't necessarily touch upon or things that I did not ask you that you would like to share, whether it's words of wisdom or diving a little bit deeper into some of the things that we already discussed.
Well, the one thing I might mention is, yeah, we spoke a little bit earlier about food sensitivities and whether or not they're actually present or if there's something deeper going on. And so I do just want to say that if someone is able to determine, like, yes, I have the food sensitivity and there's like no getting around it, there's nothing to be addressed or alleviated, I always tell my patients, you can always choose to eat a food that you know is going to give you a flare up or cause you pain or whatever it is, because sometimes it's worth it. Like sometimes it's worth it. Like if like, I don't know, it's like your grandma's homemade cake and it's your granddad's birthday or like whatever, and you're just like, I would much rather eat this cake and be in pain later than not. That is 100% valid, and that's one of the ways that I try to envelop the ideas of like food freedom with my patients, is let them know like you always have the choice, and what the goal is really just to empower people with knowledge so that you can make the choice. But we don't want people just like living in pain and without any idea like what is going on or how to feel better. So I did just want to mention that. And then the other thing I wouldn't mind dropping is just thinking about marketing. Is I don't know if you've heard about this website, Quoted, QWOTED .com, and they will blow up your inbox. I'm not gonna lie, but you can sign up to get emails from reporters who are looking for quotes. Quoted is a source that I've been using recently to get quoted, and so as a result, I've been quoted in WebMD and Everyday Health, and I was quoted in Health Magazine, but that was through a different platform. But you kind of have to be like quick on to be one of the first responders. You have to be kind of on the ball, and yeah, they will blow up your inbox. So maybe need like a filter or something set up.
You have the knowledge and you'd rather be the one giving the information than having somebody else not know where to go or giving misinformation. And so that's something too. I think a lot of times, not just in our profession, but sometimes people just feel like this imposter syndrome comes up. It's like, I don't want to be the one that people go to, or I'm not sure I know everything. But I mean, Caylee, like, the time you put in and the vast amounts of research you've done. And a lot of us too, we know the credentials we have, we know how much education we've gone through. And we also have to maintain continuing education as well to maintain our credential. And so why not put yourself out there, even if you're not running your own private practice, just to make sure that you are being able to speak out and speak on behalf of people, or at least share stories that you feel are relevant and prevalent to a larger audience. And you never know who's listening, who needs what you're about to say at that exact same time when they are looking for answers. So I love that encouragement, that kind of like business marketing pursuit. Caylee, I'm going to wrap up with my final two questions. The same two questions that I've been doing for the past 11 seasons, which is my two-parter, pun intended. What is on your plate today? Obviously, we are towards the end of our evening at the time of this recording. So what is the next thing that you would be working on whenever you're ready to start working on something? And what is the next thing that you are actually eating? What's going to be on your physical plate for your next meal?
Well, yeah, as you mentioned, the day is kind of at an end. So I saw my patients for today and finished my notes. So after we're done talking, I am done for the day, which is wonderful. But tomorrow I am like back to back all day with patients again. So, a little bit of deja vu there. I ate like a square breakfast, I ate a square lunch, but it's getting late. I know my partner is tired. So dinner might be like, it might be cereal with some nuts added, maybe some hemp seeds, a little maybe fiber. We might be doing that tonight.
That is one of my favorite things. See, right? Dietitians are humans
Real
too,
life,
everybody.
real
Real
life.
life.
Yeah.
I think I had like cheese and crackers last night and some grapes, and I was like, that's what I was craving. That's what I wanted. And it was late enough in the day that I didn't feel like having a full meal. You're allowed to, and that's really intuitive in a way too, Caylee, right? Like just coming to terms with honoring your hunger and your fullness cues and being aware of what serves you properly, and whether you have flexibility and freedom to eat something that might make you not feel so great just because you want to enjoy it, or feel like you have a little bit more of a structure and a plan. And again, it's that flexibility and freedom that we hope that people can strive to meet and feel safe and comfortable in the decisions that they're making, especially when they're managing a chronic condition like autoimmune diseases. So thank you, Caylee. It was so cool to reunite with you. And I really appreciate you coming back on here and giving us a little insight into what you've been working on these days.
Thanks for having me. The pleasure's been mine.